What's next in global events? Third World War? The Rapture? A revival? The Great Tribulation? The body of Christ has been misinformed and misled for so long by the cunning craftiness of deceitful plotting. Once we understand God's eternal purpose for the earth and humanity, and then His pattern, principles, and plans, we will have an understanding about why things are going the way they are in the world. Enroll today for the Next Move of God course from the Kingdom University to find out and prepare for what is coming. With the enrollment, you will receive PDF versions of the 2 latest books by Abraham John, The Birthing of a Kingdom Nation, and What Happened to God. The online course starts on October 17th, 2024. To enroll, please visit www.thekingdomuniversity.org.
Hi, everybody. Good morning. Welcome to Mamlakak Broadcast Network, to the health bulletin of this week. So wherever you are, good morning, good afternoon, good night. I hope that you are fine, and I'm praying that everything's going good with you. So this is going to be the 4th part of the cancer series. So if you haven't watched the other 3 parts, which are very important, make sure you go back to the channel and you watch them again, and make sure you take notes. Make sure you can take pictures of the PowerPoint so you can get all the information. But today we're going to focus on breast cancer. Why breast cancer? Because this month in October here in the United States, we celebrate breast cancer awareness. So it's very important that we instruct the women and the young ladies that are watching me, or the Kingdom ladies that are watching me, on how to take care of their breasts, to be able to prevent or either prevent the breast cancer or detect breast cancer early, so that they can survive the disease, as much as they can. So I want you to make sure that you take notes today as you see the different slides, and take pictures of it so that you know exactly what to do, how to check yourself, and everything else. So can you please put the first slides, please? So like we said before, we're going to focus on breast cancer. You can go to the next one. I want to tell you a little bit of the statistics first. And when I found the statistics, it's usually, what are the statistics here in the United States? And it said that breast cancer is the most common cancer in women in the United States. It's also the #1 cancer that causes death in women in the United States as well. An estimated 42,250 women and 530 men will die from breast cancer in the United States in this year. We're talking 2024, okay? And in 2024, is an estimate of 310,720 women in the United States will be diagnosed with invasive breast cancer, and 56,500 will be diagnosed with ductal carcinoma in situ. Globally, the World Health Organization Breast Cancer Initiative aims to reduce global breast cancer mortality by 2.5% every year. So they are working to try to reduce. They are working. I don't want to say it anymore, but you know what I mean by that. They are working on trying to reduce the cancer. So what type of cancer? What are the most common type of breast cancer that we have? We have what is called ductal or lobular carcinoma, which is mostly all breast cancer are carcinoma, but you know that the breast is a glandular tissue. So when the cancer is in the glandular tissue, it's called an adenocarcinoma. And you can find it either in the milk ducts or in the milk lobules. The milk ducts are the ducts where the milk is carried, and the glands is where the milk is made. So usually those are the 2 places where you can find the carcinoma, or the adenocarcinoma of the breast. And they usually classify by invasive or in situ. In situ means that it's localized, it's in one place, it haven't spread anywhere, okay? But when they say invasive, that means that it has spread to other tissues in the breast, outside of the milk ducts or the lobule of the milk lobules. So if it has spread, then they call it invasive adenocarcinoma, or if it's located in one place, then they call it in situ. The other very common type of breast cancer is what they call triple negative breast cancer. It's a very aggressive cancer, okay? And they call it like that because it doesn't make any protein it doesn't make any access to estrogen or progesterone, and it also doesn't make a protein called HER2 that is called human epidermal growth factor receptor. And this protein, what it does, it promotes the growth of cancer. So that's the reason why it makes it such an aggressive type of cancer. And then the third type of cancer that is really common is inflammatory breast cancer. It's usually in the tissue outside, in the skin of the breast. It's rare and aggressive type of invasive breast cancer in which cancer cells block lymph vessels in the skin. This causes the breast to look inflamed. So usually the women that suffer of inflammatory breast, they have like patches of redness in their breast that is warm and red and swollen, and it's a sign of inflammation. So that's usually what it look like when the women have inflammatory breast cancer. Going to the next. So what are the risk factors? When we discuss the risk factors, it's all the same risk factor we talked to in episode 1 when we talk about, the way that you eat, no resting, no sleeping, suffering from other chronic diseases, environmental factors. They're all the same risk of cancer. But these ones that I've listed here are more specific to the risk of breast cancer. So being a woman, getting older, okay, and a woman that never had a child or have never breastfed before have a higher risk of breast cancer. So if any woman that is listening to me, if you're having a baby, make sure that you breastfeed, because the breastfeeding is not only an advantage on the growth of the baby, but it's also an advantage for you to lower the risk of breast cancer. Okay, it's very important that you understand that. Okay, you can put it again. Okay, so you also have a primary family member that suffer of breast cancer. Primary family member means your mother, your sister, your aunt, your grandma, your great grandma, or your daughter, or your sister, your mom. So all those are the primary family members. If they suffer of breast cancer, then you have a higher risk of suffering of breast cancer. Also, if you have the gene, the BRCA1 and 2 gene that is positive, that's another risk that you can have breast cancer. Hormonal issues. If you have hormonal issues, that your hormones are not in control, they're imbalanced, there's also a risk of you having breast cancer. Also, taking hormone therapy, usually the women take hormone therapy when they reach menopause, just to calm the hot flashes and other symptoms that come with menopause. Most of those synthetic and hormone therapies, they also can increase your risk of breast cancer. Birth control pills, ladies, birth control pills, especially if you're still taking it after 35, they increase your risk of breast cancer. Why? Hi, Ambassador Brian, and Ambassador Victoria. The reason why they increase is because of the hormone, because they make out of hormones. So birth control pills. So listen, that's the reason. There's a reason why the Lord wants us to wait until we get married to have sex. You see that if you keep the word, that even going to keep you healthier. So stop the birth control. The birth control have other side effects also. By raising your blood pressure, increasing your risk of cardiovascular disease, and give you clots, so on and so forth. They have a whole bunch more risk for on diseases and things that can happen. But when it comes to breast cancer, birth control can do that. Environmental toxins, a lot of environmental toxins, especially everything that you put in your body, like your perfume and your lotion and your body sprays and the deodorant, anything with aluminum. If you want to use a deodorant, please use a deodorant that is free of aluminum. They find out that every woman that have breast cancer, they find that they have a high amount of aluminum in their breasts. Okay, so try to use deodorant that are free of aluminum, or just buy a natural deodorant or make a deodorant at home. You can make a deodorant at home with a little bit of arrowroot powder, coconut oil, and some essential oils, and you can make your own natural deodorant. The key about deodorant, because a lot of women say, but I cannot wear the natural deodorant, do not cover me, is that you have to detox your armpits. Doing some bentonite clay and apple cider vinegar mixture mask in your armpits, and do it every week so you can detox all the toxins that are accumulated in the lymph nodes in your armpits, so that the natural deodorant will work on you. That's something very important that you need to understand. Okay, you can go back and put the slide. And then, the regular lifestyle factors like eating habits, no smoking, no drinking alcohol, making sure that you sleep, making sure that you keep your a good weight, that you're not obese, making sure that you're moving, don't having a sedentary life. And another thing that has something to do indirectly with the risk of increasing your risk of breast cancer is using a bra that is way too tight, and then they have wires. The ties, the bras that have the wires, because if you wear it too tight and they have wires, they can cause pressure in the sides, and then stagnate the lymph flow in the area, meaning that all the detoxing garbage that's going in your lymph that's supposed to flow out so it can go back into the intestine or into the renal so that they can go out in your pee or go out in your feces is accumulated here because of the pressure on the bra. So make sure that you size your bra properly. If you don't know your proper size of the bra, make sure that you go to the store, to a department store like JCPenney, Macy's, Fifth Avenue, even Victoria's Secret, and get measured. Okay, so that you. And another thing that also is a risk of breast cancer is that every trans men and trans women also have a risk of breast cancer, because a trans man, meaning a woman that became a man, if they didn't do a mastectomy, they have a risk of breast cancer. And then a trans woman, that means a man that is taking hormones to become a woman, because of the hormone that they're taking, they're already increasing their risk of getting breast cancer, because that also regular men and men also can get breast cancer. Okay, they said that out of all the breast cancer, only 1% of the breast cancer are men breast cancer. Okay, so you can put that slide again. So how can you prevent the breast cancer? Because let me tell you something. When you go to your regular doctor and you talk about cancer prevention, what they talk to you is about a mammogram and an ultrasound or something like that. That is not really prevention. That is really early detection. Prevention is what you can do so you don't get the disease at all. So that getting your mammogram is needed so you can catch things on time, so that way you can do things earlier and have less consequence of the disease because you detected early. But it's not prevention. Prevention is actually what you can do with your lifestyle and everything so you can prevent getting the disease. So like making sure that you check yourself, making sure that you're not drinking, making sure that you are controlling your stress, making sure that you're ditching any plastic. Okay, anything in plastic. Try, if you want to drink water, do it in a glass container. Buy yourself a glass container for your water. Make sure that you store all your food in glass containers. Okay, that you if you microwave, which I don't advise for you to microwave your food, but if you have to, make it sure that it's in a glass container. Make sure that you check labels on all the products that you use, whether it's cleaning products, whether it's a detergent, whether it's cosmetic, whether it's lotion, hair products, that they don't have any parabens, that they don't have any phthalates, that they don't have any forever chemicals or anything like that, because all those are hormone disruptors that can cause the breast cancer. Make sure that you keep your phone away from you. Stop putting your laptop in. They call laptop because they fit in the lap, but don't put it in the lap. Make sure that you always put it on the table. And when you're talking in a phone, make sure that you're talking to the phone. If you are in a place that you don't care about who listening to your conversation, use your microphone in the phone and then talk like this. Try not to put it right here. And then I see a lot of women in the store that they put in their phone here in their bra. Listen, don't do that. No, put it in your pocket in the front. Don't put it in your pocket, right here in your bra. Don't put it in the back of your pants for guys, but especially for the ladies, don't do that, please. Don't do that. And make sure that you do exercising, and that you make sure that you do your checkup every month and as early as you possibly can. The self checker should start when the girls start having their periods and stuff like that. That's when you supposed to start doing your self checkup, and then you're supposed to check up every year after 40. They changed the way that they're doing it now. So if you're 40 and you have no history of family risk and you don't have the BRCA gene, then you check every other year from 40 to 50, and then when you turn 50, then you do every year. But if you have any history of family member or you have the BRCA, then you start at 35. Okay, and they want you to do it every year. Okay, so you can go to the next one. The next slide, please. Okay, so what are the things that can prevent cancer? First of all, make sure that you have a healthy microbiome. What is the microbiome? That means a healthy gut, that you don't have leaky gut, that you have enough good bacteria and bad bacteria, because remember, the good and bad bacteria support your immune system, and the immune system is the one that kills the cancer cells. Make sure that you have good levels of vitamin D. Which kind of vitamin D you want to buy? Vitamin D3. If your levels are okay, then make sure that you step in the sun every single day for at least half an hour. If you have fair skin, then 15. But this is before you put any sunblock. Because anyway, let me tell you, that sunblock is doing more damage than you staying in the sun, because the sunblock have chemicals that are being absorbed in the skin, and that is increasing your toxic load and increasing your risk of cancer. So make sure that you step into the sun as much as you can, and then don't go over it. But at least if you are like my color of skin, a little darker, a little bit more than half an hour. If you're lighter than me, then 15-20 minutes will be good enough in the sun between 8 in the morning and 11, or after 3. That is not the strongest sun of the day, so that you can make the vitamin D. Make sure that your iodine levels are normal levels. Remember what I told you, I think it was 2 Tuesdays ago, about iodine. Remember that iodine is not only needed in your thyroid, but it's needed in every glandular tissue in your body. The breast is a glandular tissue. All these women that have been told that they have dense breasts, or they have fibrocystic breasts, is because they have a deficiency in iodine. And the job of the iodine is to keep the structures of the cells of the glandular tissue. So when those structures are not defined, they're not good, then you get extra tissue, thicker areas. You can get cysts, fibromas, etc. So it's very important for us to optimize your level of iodine in your diet. And if the women that are listening to me, they have been told before that you have fibrocystic or dense breast, make sure that you are taking your iodine. Okay, you can put it back. And then make sure that you eat a lot of antioxidants. Okay, that you avoid the chemicals, that you avoid synthetic hormones, that you avoid alcohol. Okay, that you do the early detection by testing yourself every month. Okay, and make sure that you check to see if you make extra estrogen. If you are an estrogen dominant kind of woman, then you need to level that out. And also you want to make sure that you control your hormones. Another person that can be estrogen dominant is when you are overweight. You're going to have more estrogen, because estrogen gets stored into your fat cells. So the more fat cells you have, the more estrogen you have. So that's why being overweight or obese is a high risk for breast cancer. Okay, you can go to the next one. So how you do the self-examination? The first question is, everybody always asks me, every woman that I ever teach this topic always asks, when is the best time to do a breast examination? The best time is 2-3 days after your period finish. After your period finish, that's when you want to do that, because before your period, your breasts get more tender. If you have a cyst, they can grow before the period. Your hormones are a little unbalanced when it comes before your period. So you want to do it always 2-3 days after your period. Okay. The first thing that you want to do, you want to stand in top of the mirror, and you want to check that they're the same size, that they look the same. Okay. And then you can either lay down or stand up, and you're going to use these 4 fingers to check your breast. You first go up and down like this, up and down, and then you can go circular, and everything that you do a circle, you go deeper. You press deeper. So that's the first thing that you want. Up and down, you want to do in wedges, and you want to do in circles. Then you want to examine the breast in the mirror. Go in the next one so they can see what they're looking in the mirror when they're looking at the breast. Okay, what are the changes in your breast that you want to see, that you want to report, that you want to make sure that you tell the doctor about it? The first thing is you have itchy, scaly, sore, or rash on your nipples. You have any type of rash in your nipple, and the areolar is the darker area around your nipples. So that darker area around your nipple, if you are itchy, scaly, rashes, you want to make sure you tell the doctor. If you're pulling in, that means that the nipple is inverted. The nipple is inverted. That's another thing that you want to tell the doctor. It's another risk for breast cancer. If you have any discharge from your nipples, okay, and you are not pregnant nor breastfeeding, okay, and you're having discharge of milk, then you need to make sure that you tell your doctor. If you have any new pain in any particular spot of your breast that doesn't go away, okay, you want to make sure that you tell that to the doctor. Go to the next one, producer. Okay. If you see a lump, if you feel when you do your tax, when you manual tax, if you see or you feel a lump or a knot in your breast or your underarm, then that's another thing that you need to tell the doctor. If you see any swelling, any warmth, any redness, any darkening on the breast, you got to tell the doctor. Now, remember that when you become pregnant, it is normal that your areolar area get darker than what it usually is while you're pregnant. Okay, so those are things that you have to make sure you know. But if you get that darkness outside the areolar area by patches, like you see in the picture, then you want to make sure that you tell the doctor. If your breasts are not the same size, now, every woman know, if you really look at your breasts, you know that sometimes your breasts are not necessarily the same size, or one might be looking a little this way, but you already need to know the reason why you check every month, because you need to know what is normal for your breasts. You need to know what your breasts look normally, and then you can see if they're really in different size. And if they're in different size and one is bigger or something, then you need to tell the doctor. And you have any dimpling, like the dimples that some people have in the cheeks. But if you have any dimple in the tissues of your breast, in any area of your breast, that's another time that you have to tell the doctor right away to get a deeper checkup of your breasts. Okay. So what kind of breast cancer testing that they do? So the first thing that they do, and what they do up to you turn 40, if you don't have any risk, is that when you go and do your PAP every year, you go to the OBGYN to get your PAP, they're going to do the same thing that you do to yourself, but they're going to do it themselves. The doctor's going to check to make sure that there's nothing, okay? Then the next thing that they will do when you turn 40 is they're going to allow you to have a mammogram. The picture is not an order of needs here. They're just telling you that the test results, but usually what they will do a mammogram. And then what happens sometimes is that mammogram, when the first mammogram was not clear, okay, or you had dense breast or fibrocystic breast, then they're going to want to do a second mammogram with what they call deeper compressions. I mean, they're going to press more, and they will add up an ultrasound to see better, okay? And sometimes when that doesn't work, then they might do a breast MRI. If they find a cancer, they're going to be doing a biopsy. So that way they're going to take a little bit of that breast. They're going to do like a ultrasound guided biopsy, that they take a little bit of the tissue where the cancer is to see if that's cancer. Okay. And then once they have the tissue and they figure out that it's cancer, then they do the staging. What is it? Stage 1, stage 2, stage 3, or stage 4. Okay. And that's the way they find the cancer. But there's go to the next one, please. So let me tell you about mammograms first. There is a controversy going on right now between the holistic and natural medicine, functional medicine, and then the regular conventional medicine, between mammograms and thermograph. Because mammograms, they said that it have a high rate of false positive. They say that it results in unnecessary biopsies and treatment. They say that subject patient to painful and also to a cumulative exposure of radiation. Especially, for example, they go and do your mammogram and they see that you have dense breast. Now they do have to do it again with compression views and an ultrasound. So every single time that you expose yourself to radiation, you know that radiation is a risk of getting cancer. So you're having a cumulative exposure to radiation every single time you get a mammogram. And then there's also stimulate cancer growth and metastasis. Some of the people in the natural field, they said that when they pressing your breast, when they're compressing your breast, let's say you do have a tumor there, they're pressing the tumor. That they said that the pressing in the cells of the tumor can spread. They said that can happen if you do having a tumor. They said sometimes it doesn't see very well, especially when a breast is dense. You don't get to see very well. But the good thing is that they say that thermograms are really good when the woman have a dense or fibrocystic breast. It says that it provides information on the root cause of the cancer. The thermogram detects the growth of cancer cells prior to the tumor formation. It also doesn't expose you to any radiation. It doesn't compress. It's not painful. It's not pressing you into your breast or anything like that. It measures also the inflammation in your body, and it also provides information on vascular activity in the breast. The good thing is that when I remember when I started my career in natural medicine 12 years ago, you couldn't find any information about thermogram anywhere, especially in any of the conventional, in the Breast Cancer Society or anything like that. You couldn't find anything that have to do with the thermogram. Now you find the information. They compare both, but they always say at the end, but the mammogram is better, even though that they're saying this thing, that they're saying how can detect. Even I found in one of the pages that they talk about how in the mammogram, they discover only 75 of the cancers, and 25% of the cancers are false positive. While they said that with the thermogram, they found 90%, but they still suggested that the best thing to do, they said themselves in the same page but they still suggested at the bottom that the best thing was a mammogram in the page. But of course, because the mammogram is the only test that the insurance will pay. If you want a thermogram, you had to do it yourself, and it costs here in the United States about $250 for you to do a thermogram. What I do for myself is that I will prefer doing the thermogram because I have the fibrocystic dense breast. So I'd rather do the thermograph than because in the mammogram they says specifically that it's very difficult for them to see any cancer if they do it in a mammogram. So I might as well do the thermogram and avoid the exposure of the treatment, the radiation, and avoid the pressure and compression and all that hurts. For me, it hurts, and other ladies doesn't hurt, but for me it hurts. So you can go to the next one, please. And what are the treatments? We already discussed a little bit about what are the treatments of cancer earlier, last week actually, but it's almost the same. Usually what they do with cancer is that they're gonna see if you have any cancer. Once they have the cancer, they're going to try to do to remove the tumor, whether it's they remove the whole tumor or just a section of the tumor. And then after, sometimes depending on the size of the tumor, they might do radiation first to shrink the tumor, then they do surgery, then they do chemotherapy, or they might do the surgery first and only radiation. Okay, depending on what stage of the cancer are you and what your body can tolerate. I always say that everybody that come with the diagnosis of breast cancer, try to take a complementary treatment, one that use natural together with the conventional if it's possible, or if you can eliminate the conventional and just do the natural, even better. It all depends on what stage of the cancer you are. It's depending which one you're going to choose. But always shoot the complementary, because the complementary will boost your immune system. Imagine if they give you chemo, and when they give you chemo, they they suppress your immune system. But the immune system is supposed to be the one fighting the cancer. Then what happens is that they do chemo, they kill everything, but they suppress your immune system. So is there any stem cancer cell floating around because your immune system is depressed? Eventually, in a few years or in a few months, you're going to get the cancer again because you have stem cells growing that nobody can attack because your immune system is suppressed. When you do a complementary treatment, they do things to boost your immune system before treatment and then after treatment. Or they do the type of chemotherapy that I was showing you last week, the IPT, which is the therapy that they apply insulin first, because what happens is that our cells have certain amounts of or maybe one or two garages, I call it, a pathway where the insulin goes to put the sugar. But the cancer cells, because they love sugar, they have 10 or 20 to try to make the same amount of energy that a normal cell is. So when they put the insulin is going to be attracted to all those different openings. And then when they put the chemotherapy, the normal cells are going to get just a little bit of chemotherapy, but the cancer cell is going to get 10 times, on depending on how many doors they have of the chemotherapy, and it's more direct. So that's maybe the type of a treatment that you will try to get if you're going to get some chemotherapy. And usually when they do that test, they boost your immune system at the beginning first. They do the treatment and then they boost your immune system with something else natural. Again, like I talked to you, all the different, if you want to learn about all the different tests, all the different natural things that they do, you can go back into the series and look at the video that I talk about that. So I hope this information help you a lot, that for you to understand the important for us to take care of your breast. Remember to start checking your breast. The little girls, you should already teach them how to do it as soon as they get their periods and stuff like that, that they know, so that they can recognize how their breasts look and feel. So as the year goes by, they can detect anything, because nowadays we have a lot of women, especially Hispanics and Blacks. They have more risk of getting cancer before 50 than a regular white person that is not Hispanic. Okay, but Hispanics and Black, we have a higher risk of dying of cancer and of getting breast cancer than a white woman does. Okay, so it's very important that we teach our girls at a young age to know how to check, to know their breasts, to know what they're supposed to look, so they can tell you right away. Okay, and make sure that when you do your mammogram when you do your pap every year, and when you do your physical every year, that they examine, that the doctor also examine the breast, so just in case anything happens. Then remember that if you have any risk, meaning that you have the BRCA gene, that you have family members that have breast cancer, or you already suffered any other type of cancer before, or had any chemo before, or any radiation before, for any other thing, that means that your risk of cancer is higher, then you have to start younger. In that case, you start at 35 or younger if you feel something in your breast earlier than that. Okay, so I hope this information help you. Remember to go back and watch the whole series if you want. So make sure to get all the information. Remember that prevention is necessary, and the only way that you can prevent is knowing exactly how to lower your risk of getting cancer. And because getting the test is just to get the test, to know that you have it earlier, or get it, make sure that you detect it as early as possible, so you can have a better outcome from it. But the key, and what we want to do, is totally prevention. Okay, that's what God wants us to do. Why? Because God needs our body. This is the only vessel that we have, and we need to be healthy and strong so we can fulfill, okay, the purpose that God have for us. And remember that taking care of yourself, taking care of your body, is part of your kingdom lifestyle. It's part of worshiping the Lord. Worshiping the Lord is not only singing the song on Sundays or putting a worship song, but your lifestyle, taking care of yourself, because this is the vessel and the temple of the Holy Spirit. Okay, taking care of it, it's also a way for you to worship the Lord. And it's a way that as a king and as a queen, as a daughter of God, as an ambassador of God, that you will take care of yourself really good, because you want to be able to do the things that the Lord have for you to do, and you also want to enjoy life. God bring us here not to suffer. He said that we're going to have trials, that we're going to have tribulation, but He walked with us through it. But He still wants us to enjoy life, and in order for us to be able to enjoy life, we need to take care of our bodies, remembering that the doctors are responsible of your sick care, but you are responsible of your health care. So our health care and our well-being is our responsibility. Okay, it's yours and mine responsibility, not the doctor. The doctor is part of the team that you put together to take care of your well-being. Okay, so thank you so very much, and I see you next Tuesday. Actually, next Tuesday we're going to do something different. Okay.